Hey guys, it's Dave. Today we're going to talk about a condition that is kind of rare, but if it happens to you, it's very important you get into the doctor right away or the emergency room because it has some very serious implications. That's Stevens-Johnson syndrome. It's a disorder of the mucous membranes and the skin. Actually, it's related strictly to one of two causes. Number one being medications, and the second is related to being caused secondary to another infection. What happens is you'll see flu-like symptoms before a rash actually occurs. 1 to 3 days prior to the rash, you'll see burning eyes, fatigue, fever, sore throat, sore mouth, and really inflamed in there. If you've ever had canker sores in your mouth, that's the kind of pain and the soreness that you're talking about inside the mouth. That leads to skin pain. Your skin will be very sensitive to touch, to any brush up against anything. A bright red to purple rash will then occur that blisters, pustules. The pustules will open. Your skin will literally shed off. And it is a very painful condition. It is rare, it's very unpredictable, and basically your genetics set you up for how the disease is going to run its course. So you need to be really aware of your family members. If they've ever had this happen to them, you need to be aware anytime you start a new medication that this is a possibility for you. As far as infections, what are the infections that mainly lead to it? You're looking at HIV as the number one infection-related cause of it. Secondly is pneumonia. And why pneumonia? Really, you're looking at people whose immune system is exhausted. They've been through pneumonia, it's shutting down, they're going to be more prone to it. As far as medications, what are the ones you're looking at? If you're on gout medications, like allopurinol, those medications can cause it. Seizure medications, so things like carbamazepine, Dilantin or phenytoin, those medications can also cause it. Biramune is another one. Sulfa antibiotics, so things like sulfasalazine, Bactrim DS or Scepter DS, which is sulfamethoxazole trimethoprim. Really, that drug can cause a lot of skin conditions, so you want to watch out when you're on it, but it will make you more prone to this. Non-steroidal anti-inflammatories, so ibuprofen, naproxen, diclofenac, that class of drug can make you prone to this, and sometimes even Tylenol, you can see it with that. Antipsychotics, so things like haloperidol, Seroquel, ziprasidone, those drugs, paliperidone, can also make you more prone to it. But where you really run into problems is if you're a patient that is on more than one of those at the same time. There may not be a drug interaction, but it's enough to set off what is in your genetic makeup to start the process leading to Stevens-Johnson syndrome. So if you're on a combination of those, watch out, be wary of it. If your provider wants to put you on, you may just say, hey, you know what, this runs in my family, please keep an eye out for it. Risk factors for Stevens-Johnson are, if you are a patient with HIV, be on the lookout. If you have a weakened immune system, if you have cancer, of course your immune system's already weakened. Don't forget to take your vitamin D, by the way. If you have a family history or you yourself have had this before, you want to always be careful, especially when starting new medications. That is right there. You should have the hair on the back of your neck going up with any new medication, because there's always a possibility, because it's your genetic makeup that can clue you in to how it's going to go. As far as complications, first is dehydration. Your skin is sloughing off. Your body is going to be dehydrated. Skin issues. You can have, again, very painful condition. You can develop scarring. discoloration of the skin. The pigmentation can actually change when your skin grows back. Infection, sepsis, is a very serious one that can be deadly. Eye situations, your vision can be affected. Dry eyes is the easy one. Of course, you can treat that with over-the-counter drops, but you can see double vision, blurred vision. Your vision in itself can deteriorate because of this situation. So the complications can be severe. You need to go in and get things checked out right away if you think that this is occurring. As far as tips, if you have a family history of this, and you can ask your aunt, your uncle, your mom, your dad, your brother or sister, what medication started the Stevens-Johnson in you. They can relay, hey, it was allopurinol. I was using it for gout. Guess what? That same medication will probably trigger you as well. You can do genetic testing to actually figure it out if that drug would be safe for you or not. But side on the caution, if that's not available, you don't want to do it. If that is what triggered your family member, don't take it. Have the discussion with your provider.